Hey everyone, welcome back to another episode of The Period Party. It's been quite a month over here. The week before my birthday, I developed acute appendicitis and needed emergency surgery that day. Of course, it was also the week before launching my women's hormone health certification program, so I literally asked the doctor upon delivering this news to me if we could postpone the surgery till the end of September. Pretty sure he almost laughed at me. Anyway, I had the surgery. It all went really, really well, and I'm doing so much better. And I'm convinced that my appendix was causing all kinds of inflammation and problems for a really long time because I feel so amazing after having it removed. Not that this is an endorsement for you to go have your appendix removed, but clearly mine was a problem for a very long time. Anyway, this week I am chatting with my friend Dr. Jessica Drummond. She's the CEO of the Integrative Women's Health Institute and author of Outsmart Endometriosis. Jessica holds licenses in physical therapy and clinical nutrition and is a board certified health coach. She has 20 years of experience working with women with chronic pelvic pain, and her program, Outsmart Endometriosis, is truly a beacon for so many who are struggling with this condition. I can't recommend it highly enough. You can find her book and program at outsmartendo.com. Enjoy this episode. It is really enlightening. Hey, Jess, thank you so much for being on the show.
Hi, thanks so much for having me, Nicole. It's my pleasure to be here.
Yes, as always. I feel like this is maybe your third or fourth time now with me. So thank you. I know
Yay, I
you
appreciate it.
spreading the endometriosis knowledge far and wide.
Yeah.
I actually was thinking about this morning when I was looking over our talking points and whatnot and preparing for this interview. And the number that we hear in terms of the prevalence of endometriosis is 176 million women worldwide, or 1 in 10 women. And I feel like I've been hearing that number for many years. And I'm curious if this has changed, and is it going up because we're just more aware of it, or is it that it is just more prevalent?
It's not changed in terms of the absolute number of people who have endometriosis, although I am heartened to say that absolutely there's a lot more dialogue about endometriosis, even in the popular media, hopefully. Well, and that does seem to be translating to research and conversation. I got a great email just yesterday from a brand new integrative OBGYN who was like, thank you so much. I'm listening to all your, she's in our courses, and she's like, I'm listening to your lectures, and I'm now able to create an integrative endometriosis program out here in California in the just a regular primary medical hospital situation. So I think the word is getting out. It only took 20 years, but it's
I know.
coming. So the absolute numbers are unchanged, but the conversation is much more prevalent. So I think people are more aware that they could have endometriosis, what endometriosis is. But there was a study done a while ago that essentially looked at the prevalence of endometriosis in fetuses, and it's 9% of fetuses with uteruses, if you could say that. So it's basically the same as what we see later expressed in, teen or tween even, and teen girls and women once the endo expresses. Now, endo is not always symptomatic, but the prevalence does seem to be about 10%.
Okay, that's fascinating. We're going to come back to that whole symptomatic versus non-symptomatic thing for sure. So can we talk a little bit about endometriosis versus having painful periods? Because obviously, as we know, period pain in our society has been completely normalized. And I always kind of joke, and sort of joke, but not really joke, that uterine pain is never really taken seriously, but pain in other parts of the body is. Go figure.
Yeah.
And so I'm curious about that. Like, what's the difference between having pain from endometriosis and having period pain?
Right. So period pain is a potential symptom of endometriosis, but endometriosis is a full body disease. So people can have pain during other times, not just their menstrual cycles, although some people do have it consistently just with the cycle. Some people have it all the time. Some people have it at other times. Ovulation is very common, of course. And endometriosis lesions are not just in the pelvic region. They can be all over the bowel. They can be all over the bladder. They can be externally to all of the reproductive organs. They can be on soft tissues like ligaments and fascia. They can be on the diaphragm, on the lung, inside the nose. They've been found on the knee joint. So you could have pain in a number of places. It's very common with endometriosis to have a lot of fatigue because you're walking around with a inflammatory condition and potentially autoimmune factors involved. You can have breathing pattern dysfunction because endometriosis extra pelvically, as we say, outside of the pelvis and the abdominal area, can cause breathing pattern disorder, headaches, fatigue, insomnia, painful sex, of course, depending on where the endo is and how much inflammation there is. And more, I'm seeing a lot of overlay with other chronic conditions, things like Ehlers-Danlos, hypermobility syndromes, dysautonomia, chronic Epstein-Barr and other viruses, chronic mold toxicity. Now, of course, that could also happen with other causes of period pain because there are simpler challenges kind of at a root cause level of what can cause painful periods, anything from estrogen dominance to liver stagnation or non-optimal liver functioning. Constipation can cause period pain. Pelvic floor dysfunction can cause period pain. And all of those things can also happen with endometriosis. Clearly, the big distinguisher is someone actually has endometriosis lesions. The tricky part, though, is that it's very hard to get that distinction diagnosed. Right. So just by symptoms alone, we won't know if someone has period pain from another cause unless we can see it on imaging, for example, something like PCOS. Although honestly, if a person has PCOS and pain, because usually PCOS is not particularly painful, they usually also have endometriosis. Not 100% of the time, but often. But the only way to diagnose endometriosis, if it's not seen on imaging, which is very common, you can't rule it out if you don't see it on imaging, is to do a laparoscopic surgery. So it's a little tricky because getting that clean diagnosis of endometriosis, while much better than it was 15, 20 years ago, is still complicated. And it depends on your access to skilled practitioners to really know whether or not you have period pain from some other cause or that and or endo.
Right. I mean, there's, first of all, so many things to unpack here. I will just say, after having gone through laparoscopic surgery just 3 weeks ago, it's a big freaking deal. And so it's one of those things where you can't go into this lightly. And I've seen so many scenarios where women will say to me, but I don't want to go through the surgery. So what do I do? And so I'm curious what your thoughts are on that, because obviously not everybody wants to go through the diagnostic criteria that they might have to.
Right. So in that sense, I would, if you don't want to have surgery, that's a choice. Endometriosis is not generally, although it can be in some cases, life-threatening. It's more quality of life-threatening, which is very important. But it's a distinction in terms of whether or not you need a clean diagnosis to make lifestyle, behavioral health changes. However, there's one significant benefit to having early assessment by a skilled endometriosis excision surgeon, notwithstanding, of course, the symptomatic benefits and kind of taking out the disease process, if you will. But the earlier you find out if you actually have endometriosis or not, and it's excised, or literally the lesions themselves are cut out. So again, we think of endometriosis as kind of like a non-cancerous cancer. There are these aberrant cells growing in places they shouldn't be. When you have that removed by a skilled excision surgeon, the data does show that your fertility is better preserved. So if fertility is a goal, the earlier that you know that you have endo, the better for long-term fertility preservation. Because even if the endo is not like structurally blocking your fallopian tubes or something like that, just having endo can reduce the quality of your eggs. Now, does that change if you're living a super anti-inflammatory diet and lifestyle and supplements and all that? Maybe, but we don't have any data to say that. So we have to err with the side of caution when fertility is a strong goal for someone.
So talk to me about that. Like, why is it affecting egg quality?
Probably it's the chronic inflammatory issue, and also the autoimmune markers, because post-excision surgery, autoimmune markers drop dramatically just by the sake of having surgery for at least the first year. And we published some data back in like 2016 looking at case studies on vulvodynia, trying to extend that window. And vulvodynia and endometriosis have a lot of overlap and similarity. So the goal for my work is to say, okay, whether or not you had surgery, my goal is to improve the functioning of your immune system such that your eggs can be healthier, you're not so inflamed, you're not dealing with so many symptoms. But it also potentially could help preserve fertility, but we don't have data to that effect.
Got it. Okay. And can we come back to the painful periods versus endo painful periods? Because you mentioned a ton of things. Obviously, you mentioned autoimmune disorders and other conditions. You talked about sort of this inflammation and all these reasons why one might have painful periods, mold toxicity, etc. Um, I feel like so much of these are contributors to painful periods. They're also contributors to endometriosis, inflammation, and pain. And so, do you feel like getting a lot of this under control for someone who might have been told that they have endometriosis, but really they just have painful periods because of dietary, lifestyle, gut health issues, things like that? Once those things are under control, do symptoms pretty much disappear? I mean, for women who I've worked with who have painful periods almost across the board, it's 90 to 100% improved based on how many changes they make, and I feel like that's the case with endometriosis, not 90 to 100% per se, but there is a significant improvement.
Absolutely. So that's essentially all that I do in my work, right? We have step one, regulate the nervous system, which we have to keep doing and coming back to constantly, because the stress buffering system, how the nervous system interacts with the immune system, all of that is essential for immune health, and thus pain, dysautonomia, nausea, digestive issues, et cetera, et cetera. So one is nervous system regulation. Two is anti-inflammatory nutrition, supplementation, gut microbiome balancing would be three. Actually, before that, I would say digestive system functioning. Is someone breaking down their food well in the stomach? Are they eating in a calm manner? How are their neurotransmitters? How's the lining of the small intestine? Are we dealing with SIBO or SIFO? How's the colon function? How's the pelvic floor function, right? So all of that is like what you're working on, right? Diet, lifestyle. We do the exact same thing over here. And in many cases, endometriosis symptoms completely resolve without surgery. However, fertility is not necessarily preserved. That's the big question mark. So you might never know you had endo. Let's say you just had pretty intensely painful periods, like they're taking you out of school or work every month, or at least occasionally. That to me is a red flag for endometriosis, but it could be caused by something else. You could very well clean it up with lifestyle and pelvic floor therapy and mindfulness and trauma release and all of the things that we do. And that may benefit your fertility. We've just never done the studies, so we don't know. Is it enough? And so that's why excision surgery to me is still a really important part of the conversation, because I've absolutely seen people completely resolve their symptoms without excision surgery, but they do still have some endometriosis lesions. Now, we do have one study on, it's a randomized controlled trial comparing pycnogenol, which is a powerful anti-inflammatory supplement, with Lupron, which is a powerful GnRH agonist, I believe. And it essentially puts you into a transient menopause. So really shuts down estrogen. Both of those are equally as effective at stabilizing mild I've seen endometriomas on imaging that are like, what would you call this? Like baby football size, like they're huge, small melon
grapefruit.
Like
exactly.
They're giant. That can be problematic if it's in the lung. It can be life-threatening. There are some things that we have to take very seriously and want to keep searching for, but tiny lesions can be stabilized with pycnogenol equally as well as GnRH agonists, with far fewer side effects. I mean, I almost never would recommend someone going on Lupron. The side effects are so intense, everything from suicide risk to mental health issues to just, it's really
bone
rough.
loss. Osteoporosis,
bone loss.
I've seen that in teenagers.
Yeah, cardiovascular issues, all of it. So you can stabilize. That's the only study I've seen that showed actual stabilization of small lesions using like an anti-inflammatory approach.
But in your practice, I assume you've seen it anecdotally.
Oh, of course. I couldn't say that I've seen, we don't go back and image before and after. Right. I don't see people pre and post surgery. Like people basically generally when someone goes in to do the surgery, they just clean everything up then and don't go back in unless there's an issue. So we can't say that the lesions themselves are impacted, but certainly the immune system is functioning more optimally. That's why it's sort of our whole tagline is don't chase symptoms, optimize systems, right? Because if your immune system is functioning better, if your nervous system is functioning better, if your digestive system and musculoskeletal systems are functioning better, very often, almost all of the symptoms are improved significantly, if not completely eliminated. But sometimes we do see people who have really done everything right for a sustained period of time, 6 months or so, and they're still having bothersome symptoms. That also requires surgery and is reasonably common. I don't have really data about how common, but both of those things are potential possibilities. One, going through all the steps, like literally following this book like a instruction manual, and then symptoms completely resolving or being much, much more manageable, and doing all of that, still having some residual symptoms, then going through surgery, then go back to recover. And I think the other thing that's very important to emphasize is that, there's still an underlying genetic component. So I think this disease state really has to be considered as lifelong management. Yeah. You can't sort of like spend 6 months optimizing your health, get your symptoms well under control, and then sort of go back to poor just like lifestyle strategies. And ice cream. Yes. Now you do become more resilient. You can do that occasionally, but it is something that requires kind of a maintenance mindset as well.
Yeah. But that would be the case with any condition, right? Any condition that expresses itself, and then you have to sort of like backtrack and figure out what's going on and address the underlying causes or the triggers, like you said.
Yeah, absolutely. And I think we can't, that's really the truth with everything. Like health is a continuum. The more you give it attention and resources and so forth, the healthier you'll be on that continuum. But we have to also take into account that so many other things matter, like someone's ACE score, someone's financial resources, someone's medical trauma from dealing with endometriosis, the intermittent, like, are they still living in a moldy house? How was their surgical experience? There's so many factors, but I do think it's important to empower people that there's a lot that they can do.
Yeah.
And they don't have to do everything, because that can feel very overwhelming. Learning to take care of yourself healthfully in a really unhealthy environment, which almost everyone is living in at some level. We can't put all of the pressure on individuals to sort of quote unquote heal of themselves, because that can feel very overwhelming, and it's actually not necessary. You can occasionally eat cookies and ice cream and still be fine, but
Yeah.
it's more like a couple times a year than a couple times a week.
Right. Yeah, for sure. And that makes sense. And, I do want to acknowledge how incredibly confusing endometriosis is because, as you probably do, I get just so many questions on a weekly basis from confused, frustrated, exhausted women and girls. I even had a 13-year-old in my DMs recently whose mom wanted to just put her on the pill after multiple doctors in the UK with the NHS system had suggested. And she was asking me for more specific advice because she just felt in her gut that that wasn't the right path for her. I think maybe she followed my work and understood that to some degree. And so she was asking for somebody else who could potentially help her. And so I would love to talk about that, like the pill being such a widespread treatment recommendation for endometriosis. And what's the real truth about that?
The reality is that it suppresses symptoms. So
Yeah.
some of that intense pelvic pain, especially in period pain, in about 30% of the cases. The studies vary, but and that's actually very important. I think we want to be careful of completely villainizing the pill
Yes.
for people with endometriosis, because again, like, having excision surgery is not, unfortunately, because of many political factors and other factors, standard of care.
Right.
Having integrative support for endometriosis is not standard of care. So unless you have it, and it's also very expensive to provide as a person who provides that care. It's very intense, it's very personalized, it's very complicated. It requires, decades of postgraduate training. And so both surgery and integrative care come with very hefty price tags,
100%.
tens of thousands of dollars minimum.
And that's in the
Um,
US. I mean, it's just not even available. Like when I think about Antigua, where I come from, I mean, those options are not even available. Nothing, none of that. You have to
right.
travel to the US or somewhere else.
Right. And
Yeah.
so in socialized medicine countries like in the UK and Canada, it's sometimes available privately or within the system, but only after you trial, something like hormonal birth control for at least a year, and then you're on a waiting list. Even in the US, it takes a year in many cases to get surgery, unless it's an urgent case, which is most of the time it's not considered that. So, you know, it's, again, we talked about endometriosis being intensely quality of life limiting.
Yeah.
And so hormonal birth control is an option for managing symptoms for quite a few people that is literally life-saving, in the sense that they can actually go to work, go to school, you know, breathe during their periods. So I don't want to discount the benefit, but it is not treating endometriosis in any sense. It's maybe suppressing some of the hormonal dysregulation that exacerbates the issue at the level of the lesion, and and probably doing some other things that we don't have good physiology on. But so that's helpful sometimes. It comes with a handful of side effects that really someone needs to be very aware of, particularly in teenagers: suicide risk, is dramatically increased. Well, dramatically, what does that mean? But it is increased for sure.
Yeah.
I don't want to add hyperbole unnecessarily, but it increases gut dysbiosis, it decreases immune function, immune resilience, although interestingly, it does decrease the risk of COVID, which is surprising.
I know, right? Random facts about COVID.
Random facts, but it doesn't, other things that may set you up for worse immune function because of the gut dysbiosis related to it. And what it's doing with COVID, who knows? But so I do think that so let's say you're a person with limited resources and also doing integrative strategies in a teenager who's super motivated works great. I know a lot of teenagers these days who are very health conscious. They have TikTok, they know how to do skincare routines, like they are really on it. And that's great. But for some people, it's just overwhelming to be in 8th or 9th grade. Like, think of what life is like when you're 13, right?
I know what life is like as an adult, and it's overwhelming. Yeah. So I can't even imagine being a teenager right now. It's just a lot.
It's a lot. It's a lot. So having that health conscious family mindset and lifestyle is really beneficial and will get to more of the immune root cause of endo at minimum, and also nervous system root cause, which I don't want to understate. That's extremely valuable. Yeah. But it's challenging to implement in the life of a teenager or an adult, but particularly a teenager. So if hormonal birth control temporarily gives someone a symptomatic relief such that they can go to 8th grade, they can be on the softball team, they can do what they need to do while they're hopefully making slowly but surely some of these important lifestyle changes with the support of their family and their coaches and their school nurses and their teachers. And, it takes a lot, sometimes some of their friends. That is really valuable because it's most of the time at 13 years old, it's a little early to have excision surgery.
Right.
The doctors that I know who do that probably wouldn't do excision surgery until someone was a later teenager, like at least 17 to 20 years old.
Can you explain that? Can you explain what the reasoning is behind all of that?
Well, because your menstruation, your kind of puberty hasn't even stabilized yet.
Right.
So what's going to happen, we don't know. And you also don't want to dysregulate the nervous system yet. Having a lot of support for the nervous system before a surgery is, a part of the conversation is important. The other thing that happens in teenagers, well, everyone, but an issue to definitely deal with in teenagers is dealing with the digestive symptoms. And unfortunately, the birth control pill is not going to help that and may actually make it worse. So concurrently working on digestion is really important. So again, this is not a really easy answer, but I think we have to have a conversation that shows how personalized medicine needs to be for people with endometriosis. So we don't want to limit any of the options, but we want to be thinking through the cost benefit, and we want to give people a little space to make these changes over time, because learning to live with a chronic condition is a whole other set of kind of mindset shifts as well.
For sure. And I'm so glad that we had this conversation, because I feel as though there is such a nuanced approach that needs to be taken with each person. And yet that's not typically the approach, right? That's why I wanted to ask you your thoughts on the birth control pill, because of course I recognize that might be the only option for many, many people around the world. And what you said about possibly being a teenager and getting your life back, which could be just so, life-changing for someone who has been debilitated by this, or by their period pain, or whatever they're experiencing, whatever symptoms they have, using that as a bridge. And I've always sort of thought of it as that, like, this is bridging you to the next step, and you're sort of working on other things that will support you in that process.
Yeah. And I think that's the whole thing. You don't have to choose one or the other.
Right.
In fact, in the case of endometriosis, almost all the time, it's an issue of what's working now combining with healing underneath it, right? So band-aiding the symptoms a bit and doing all the mental, the nervous system, I wouldn't say mental health, but nervous system work, the potentially, considering surgery, finding the right surgeon, meeting that person, doing pelvic floor physical therapy, doing, I do a lot of more and more trauma work now. This stuff takes time. And so if we can settle the symptoms for a little while we're working underneath that concurrently, that's great. Now, some people don't want to do surgery or the pill at all. That's also absolutely fine. It's just going to that we're going to take some more work, more time, more patience, and potentially, bigger lifestyle shifts. And some people are really ready for that and, are kind of like done with just trying all of these treatments, if you will, that don't solve the problem necessarily.
Yeah, I know. I would love to talk about that because before we were recording, we were talking about sort of the oversimplification of endometriosis. Sometimes, at least that's what we tend to see online in many cases. And, someone will say, well, this supplement works amazingly well, or this particular product, or, whatever, this lifestyle intervention. And obviously, you've been working with people who have endometriosis for, God, it's like 2 decades now, isn't it? Is it that long?
A little longer.
Yeah,
A little
longer.
longer.
Okay, even longer. All right, I won't age you.
Don't.
So yes, you have a ton of experience with this. And so one of the things we were talking about was nattokinase. I'm pronouncing it correctly now.
Mhm.
And and it being a supplement that quote unquote dissolves fibroids and endometriosis and these things, and it being highly effective. And I would love for us to talk about that, about sort of just taking this integrative approach, but not necessarily focusing on one single thing, because that usually isn't going to be the answer.
Yes. So things like these enzymes,
Yes.
nattokinase, serrapeptidase, do break down, at least in lab settings, fibrous tissues. And they also are biofilm disruptors. So they can break down adhesions potentially. We don't really have like in vivo data about that, like in actual humans, but we do have some data that these are helpful supplements in terms of symptoms and smaller lesions and smaller adhesions and things like that. So, but again, none of like taking nattokinase isn't going to cure your endo. Drinking celery juice isn't going to cure your endo. This isn't like how that works. But having some of these things that kind of break down these in the fibrous tissue that's related to adhesions and how the lesions are built is helpful. And ultimately, what they're doing is supporting your immune system to try to clean up these aberrant cells, which, is the same thing that happens with cancer or post-surgically. Doing that is helpful, but it's not like a cure for endo, in the same way that going on hormonal birth control is not a cure for endo, even though someone might be completely asymptomatic while they're on it.
Right. Yeah, and that makes so much sense. And so, um, can we talk a little bit about your protocol, like how you work with someone and how you might help someone? Because I feel like that's the biggest challenge I hear just from random women who come to me. They're just like, I just don't know where to go. Like, I don't even know what to do. And they feel lost and hopeless and confused. And I understand, because of course it's likely in many cases been years that they've been dealing with this, and they just don't know what to do next. And so I'd love
Yeah.
not a simplified version, but just a breakdown of
Yeah.
how you can help people, because you have an amazing program, and I feel like I just wish everyone could go through it. I really do. I
I
send everybody
know.
your way. I'm like, you have to just do this program. Like, you have to really go a completely different route to what you've been told, basically.
Yes. And unfortunately the word is getting out. It's being less surprising, less different than what's available a little bit. We're at least talking about it now at conferences and whatnot.
Yeah.
So first of all, is that whenever you're dealing with a chronic illness, it's so multifactorial. I had two of my patients just say to me this week, like, oh, I didn't realize how much endo was like affecting my whole life, my work, my digestion, my sleep patterns, all of this stuff. So we have you kind of step into a container with us and our team, and we have a group program now with other people going through the same thing, which is so supportive. We also work privately with people, but most people choose to work in the group setting, which is great. And just being there starts settling the nervous system, because it's like, oh, this is a process of learning, of making changes, of refining, of being healthy, but not thinking of health as a destination. Like, I cannot live my life until I get healthy, because that's a very false dichotomy of what health is. Health is a continuum, and people throughout their lives are going to be in different places on that continuum, even sometimes for absolutely no fault of their own. Like, it's just going to happen. So being in that safe space is step one to settling the nervous system. I've talked a lot about the nervous system, and I literally mean brain neurotransmitters. So we start with testing your brain neurotransmitters, your hypothalamic pituitary adrenal axis, which is your stress buffering system, with your gut microbiome, your nutrient absorption. So we do a lot of digestive, immune, and nervous system testing to see how your system is, because there isn't like a protocol for endo. It depends on what's going on that's dysregulating your nervous system, digestive, and immune systems. Then we work through healing those, everything from mindfulness strategies to digestive support supplements to digestive health, where we kind of clean up the quote unquote bad bacteria and toxicity issues, and support your detox systems, and then making sure you're absorbing nutrients. So the other problem is that a lot of people come with a lot of fear of eating and disordered eating because everything hurt since they were like 8 years old. Eating anything hurt. So, or they felt very bloated, and maybe someone body shamed them for that from their SIBO or SIFO related endo belly. I mean, again, this gets very complex from a trauma standpoint. So we look at your ACE score, we look at the trauma you've been through, we look at your why you might not want to eat very much because it hurts. And so while there are removing certain foods for a short period of time can help rest the digestive system, we have to put that into context of making sure you're getting enough nourishment and eating with a settled nervous system, which is the priority, but also really challenging because it doesn't always give immediate results. Like, this is a process that takes 6 to 12 months on average. Post-surgical recovery for anything, while no surgeon will tell you this, I've been a physical therapist for 23 years. Even if you have a mild surgery, 3 to 24 months is recovery from any surgery. Don't
Really?
push it. Yeah, the surgeons are like, you're better. What they mean is, and surgeons are excellent. I appreciate all the surgeons we work with, but they don't, their goal is to do a clean surgery that doesn't have complications. Yeah. And and that's basically it, like, to patch it all back together. And that's important stuff. Like, we need those people, we need that process, we need that treatment, but it doesn't mean you're 100% well, because there's all these levels of well, right? There's chronic inflammation, there's the trauma healing from just having had a surgery, there's changes to the immune system, right? There's all of these things. So patients, the immediate post-surgical period is generally 6 to 12 weeks, but it doesn't mean you're 100% well after that. So going into surgery, the more prepared our nervous systems can be, the easier that will be. And then coming out of surgery, you want like a nice landing for what that's going to mean. Like, who's going to be taking care of you? What are you going to be eating? What's your sleep strategy? What's your mindfulness strategy? What's your movement strategy so you're not increasing stress? So that's really the protocol. It's thinking through all those systems on an individual level, because everyone's going to have different disruptions of those systems. But a lot of it comes down to adding nourishment, settling the nervous system, and healing the immune system so it's not too overactive or too underactive.
And it's incredible, right? To think about all of these various aspects. And I think it's amazing what you do and just how you guide people through all of that. Because I was just sitting here as you were saying all of this, thinking about my appendix surgery from 3 weeks ago. And it was quite minor, generally speaking. And I'm like, oh, I feel good. Like, I think I'm good. So now I have to book an appointment with you because I just feel like, I feel like this tiny little bump under one of the incisions, and I'm like, is that a hernia? Because you don't really get any support afterwards, right? I went to see the
Right.
PA after the surgery 2 weeks later, and she was just like, "Oh yeah, you're good. Do you feel any pain?" And she said it so fast, and she pressed down. I was like, "Can you do that again?" I don't know. You're just moving so fast. And so
Yeah.
I think it's so important for everyone to hear that post surgery, there's a significant amount of time afterwards that you need to be paying attention and really taking extra good care of yourself. Because I keep thinking,
Yeah.
oh, I'm good now, but I might not be. And I don't really know what the gauge is, to be honest, because I've never had surgery before. So I would imagine a lot of people are in that situation.
Yes. And I think the big key is that, yes, you're good on many levels,
Yes.
but it's okay if you don't feel 100% better, because sometimes people feel like they failed this treatment. I tried this treatment, it failed. This treatment failed. This treatment failed. And it can become overwhelming when your doctors just keep saying, like, you're fine. And you're like, am I though? And maybe not, maybe not at the level that you want to be. And I think that's it's one of the most interesting things I learned from having long COVID. Among the people that are most sick from it are the healthiest people. And then you take a step back and you think, interesting, there's a lot of people who just kind of aren't that healthy all the time. And this is very normal for them and they feel fine.
Yeah.
So there's a really interesting continuum of what healthy means to you as well. And I think that's important, because wherever you want to be is where I want to help you be.
Mm. And that's a perfect way to wrap this up. Thank you so much. I feel like I always get such great insight into endometriosis and sort of the nature of this condition and the different ways of going about addressing it and looking at it from you. So thank you, thank you. It's very
You're
insightful.
welcome.
Yes.
Yeah, you're welcome. And I just think the number one thing to know is if you're struggling with endometriosis, you can feel really, really well.
Yeah.
It's going to take some time and some patience, but we've been doing this for literally 23 years and see a lot of people feel really, really well after 6 to 12 months, which is a really short amount of time when you think about it.
Yeah, right. I know. I completely agree with that. I know. I always say to everyone that you need about 1 to 2 months for every year that you've been experiencing symptoms to kind of give people an idea, because they're always like, well, how long do I need? And when should I
Yeah.
start feeling better? And of course, it's so individualized. So that's usually what I give people. And then, of course, that makes some people feel amazing and other people completely freak out. So just so you know, that's what Jessica is saying, everybody. 6 to 12 months is what you need.
Yes.
Yeah,
Yes.
for sure. Well, thank you. And so, can you just tell everyone who's listening where they can find out more about your program? Because I believe you have a program coming up, right, this month?
Yeah, so go to outsmartendo.com and you can learn more there. You can get a free copy of my book, Outsmart Endometriosis. Everything's at outsmartendo.com.
Okay, amazing. Thank you again. And we will obviously talk very soon.
Thanks so much.
Okay, bye.
Bye.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.